Tonight, tonight we're tackling a health story hitting every province. Signs this year's flu strain may not match the vaccine. Plus, Canada losing its measles-free status. A former chief medical officer of health joins us to break it down.
Then political drama in Ottawa as MPs vote on the federal budget with a nation avoiding the Christmas election that we all thought might take place.
Stand by. And later, I'm back with a full recap of the 2025 Grey Cup from Montreal. I'm Eddie Tkalik.
And I'm Gary MacDonald. Honest, unfiltered Canadian, the conversation we should be having, for sure. So, before we get down to business, I just want to make sure that you are part of the conversation. Post your opinions and your comments in the comment sections, and we will try and share them with everyone, as many as we can overall. Okay, so let's roll right along. We begin tonight with two major public health headlines, early indicators that this year's flu strain is shifting away from what the vaccine targeted, and Canada losing its measles-free designation. So what's ahead for the season as far as the flu is concerned and measles? And is it a part of the whole thing around vaccination fatigue? Joining us now is Dr. Wayne MacDonald. He's a former Chief Medical Officer of Health for the province of New Brunswick. Wayne, thanks for joining us this evening.
It's my pleasure.
Let's first talk a bit about the flu side of things, since that's top of mind for everyone right now. And it seems yours truly for sure, because for whatever reason, I've been fighting something for the last 2 to 3 weeks, it seems. Like a lifetime. But let's catch up. I have a couple of maps here and statistics from the Public Health Agency of Canada. This is based on the information up to November the 8th, the week ending November 8th. With the number of positive tests, it's trending up, and your detections. Population affected, 65 plus years. Outbreaks, again, number trending up, and hospitalizations are starting to trend up. So what's that really telling us overall about, are we on the verge of a major breakout in the flu season, or is this kind of following the normal curve?
Well, right now, I think what we're seeing is probably more cases than we would for this time of year. And that's not surprising, because what we look to try and predict what is going to take place in the northern hemisphere is what happened in the southern hemisphere during the summer, which is their winter month. And Australia, South America, they all experienced an early onset of influenza. And Australia broke a record this year for the number of cases. They broke a record last year, so I'm not sure exactly what you can take into that, except there were a lot of cases, a lot of transmission. So the big story this year is when you make the flu vaccine, the World Health Organization and other, people that contribute to that decision-making process, they look at what was circulating last year and what is likely to circulate this coming year, or any early trends they might have picked up. But they have to go to production so many months ahead of time, ahead of the flu season, is that things can happen in that sort of window where and the flu virus is always going through changes, and that's why we get a new vaccine every year. But in this year, there seems to be a change in what's called the H3N2. So basically, in the flu vaccine, there are the A strain and the B strain. And the A strain usually has two elements. It's called H1N1 and H3N2. And H stands for hemagglutinin, and N stands for neuraminidase. Don't matter what the big words are. They are the proteins on the virus, that help it get into cells, multiply, and break out of the cells to go to other cells. So that's what they stand for. And they're a little different on both those strains. And A is kind of the one that causes most of the havoc during the flu season. The B strain, yep, it can be there, and it can be nasty too. So now, what they have found is that in the other countries, and even in the UK, their flu season has started like a month early, and they're already reporting a large number of cases. But the H3N2 strain is the one that's causing the most trouble. And what they found in Australia and in South America was that the H3N2 had gone through the flu season about 7 different mutations, which is an unusual high number for a particular virus to go through. So what that means then is
And that was in one season?
Yep, just this past year, summer. So what that means then is that our vaccine was already in production, and the vaccine that was being used down south didn't match that either. The changes took place. So what that means is that then, does that really match the H3N2 component of the flu vaccine? Does that match this new variant that's changed? And obviously it's not matching precisely, but the question is, and we never really know this really till about midway or later in the flu season or in the flu season, how much that impacts things. Because there's still elements of that particular strain that are in the vaccine that still can provide protection to some extent. It won't be as great as what it would be if it was an exact match. So what I can tell you is that news out of Australia said that even though they broke the record number of cases, they're having troubles with vaccine uptake, and that's of concern to them. But and one report I read is that their hospitalizations were actually not any greater, even though the cases were higher. The hospitalizations were not any greater than, say, last year. And the UK has started their flu season a month early, and they're getting well into it now. And they issued a statement just in the last week. Their sort of, I guess, analysis of the effectiveness of the flu vaccine. Now, in any given year, the flu vaccine can, it's not always a perfect match, but it can be anywhere from 30 to 70% effective in terms of either preventing disease or preventing severe disease. And what they have found so far is that in children, and you're eligible to get it from 6 months of age to onward up there. But in children, it's 70% effective in the UK at this point of preventing visits to the ER, visits to the hospital to be seeking care for the flu vaccine. For the older population, it's about, I think it's about 40% effective, which isn't too bad because in a normal flu year, depending on the match, it can range from about 30% to 60%. So they are optimistic, and their chief medical officer for the country had issued a statement that, look, this is looking okay in terms of the vaccine providing protection. Is it the full protection? No, not necessarily that we would want to see with an exact match, but it's there. It's providing protection, and they're taking some great solace in that. Now, so how that translates later on in the season, we don't know, but the message here is it's still important to get a flu vaccination, and because the 2 other strains are in there, they're still circulating around causing disease too. So don't throw your hands up in the air and say, oh, well, it's not going to do any good. Well, sure, you got 2 other strains that are pretty much trending well in terms of when they isolate the strains and they test them in the lab against the serum, they're still working good. There's still very good matches. And the other one still, even if not exact match, at this point, certainly will reduce severity of the disease, reduce the hospitalizations, reduce ICU admissions, and reduce deaths. So it still is there. Will it be a worse year or a bad, very, very bad year? It's kind of up in the air. This new strain, it's the ability to transmit to other people has become easier. Does that mean it's going to make you sicker? Yeah, you probably won't have that full protection, but it is still providing some protection against being more severely sick. So, does that make sense to you,
Yeah,
everybody here? Or?
yeah.
Yeah, it does. Yeah.
Well, when you say the ability, how did you phrase that? The ability to transmit to people is what now?
The ability, the transmission component of it
Right.
is increased.
It
So
has okay.
whatever those changes are, they're making it easier to transmit from one person to another, to get into your body, into your
Right. And
respiratory system.
is that in part because of the fact that a lot of people have the vaccination fatigue factor and they're not bothering, and we're not
No,
wearing masks, we're not as vigilant as we were a couple of years ago with the pandemic.
well, let's put that aside for a second. The virus itself, for the changes,
Right.
and those two proteins I mentioned, the changes are such that it is more easy, whether you had the vaccine or not, for it to be transmitted to people, for it to enter into your system. Then once it gets there, if you have been vaccinated, then the forces are called out to respond to this, and so far it's not doing too bad in responding to it. Is it the exact match? No, it's not. But it's going to lessen the severity, lessen your visits to the hospital, lessen hospitalizations. So at this point in time, at the end of the season, there might be a different story, maybe go through more changes. But getting back to what you're saying is that the Australians, their numbers were low in vaccination. Even in the UK, there are areas of the country, like normally we try for influenza to get around 75% of the population immunized. And there are pockets in the UK, some countries in Europe, they're under 50% vaccinated. So that in its own right, if you're not vaccinated at all, you've got three strains that are going to be hitting you at some point in time, or one of the three will hit you during the season, more than not, in terms of that. And why is that so? And now we'll go into the next conversation about measles. But in general, immunization rates are low. They're not what they should be. And the reasons for that, Gary, you mentioned the vaccine fatigue. Yes, that's been talked about, especially since COVID, the big rush, the push to have COVID vaccines out there. We were getting them twice a year. Some of us older folks, depending what province you live on, are still getting them twice a year. And that plays on people after a while. So you've got that. You've got this whole thing about, and this is very important, it's vaccine hesitancy. So people are hesitant to get vaccines for whatever reason. There still is concern that maybe vaccines are having side effects or whatever that aren't being reported by big pharma or whatever, and a concern about what it might be doing to you. And that's sort of that was magnified by COVID. But you still have that, and you still have pockets like we'll get to measles in a second, how that broke up. But there are some areas of the country where the rate is okay, or in a province, but then you'll have pockets or sections of a province that either the way they live, they don't get the information about vaccines, they don't visit their doctors often, they don't visit public health, so it's not high on their radar, or it just may be a personal or cultural, religious thing that vaccination is not high on their radar, or they just don't want to do it. And then you have, with COVID, we got our children in terms of that and adults, we got off schedule with our regular vaccines because the whole emphasis was on putting resources into getting people vaccinated against COVID. So there's some catch up there, there's some fall behind there, and we have the situation in Canada that there are so many people without a primary care provider, be it a physician or nurse practitioner. Where do they get their immunizations? So, or who promotes them to them? And so we have that as well. And so there's a whole number of factors that are coming to play here. And the thing about it is too, and we'll maybe talk about it when we get into measles a little bit, that what else can factor into it. But does that make sense about the flu vaccine? But I just want to emphasize, don't say, okay, it's not a match. That's only one of three. That's not the exact match or as good as a match as they thought. The other two strains are still circulating, so be careful. But even still, this will provide you some element of protection. Maybe not as great as a perfect year, but there's not many perfect years when it comes to the flu vaccine. And like the news from the UK is actually quite encouraging at this point in time, that they're seeing it still being protective in all age groups, especially the children. But the bothersome thing about me is everybody talks about the higher risk age group from 65 and over. And in the UK, they've got only 60% of their 65s and overs vaccinated. So, I mean, if people are ending up in hospital, it may not be exactly because of the mismatch or the not exact match. It may be the fact that they're not vaccinated. So,
Well, we have a couple of comments, and I'd like to bring those up. Unfortunately, you'll be able to see them, and I'll be reading them anyway, but we don't have a three-shot for the comment section, so I'll just bring those up quickly, and then we'll go back and respond. Okay, the first one comes in from Manel, and Manel says, for sure the nonsense in the USA is affecting Canadians, or is this really a lack of doctors thing more than anything else?
Well, the lack of a primary care provider is an important part of this whole equation. Somebody that promotes the vaccines, that provides the vaccines, and if you don't have that provider, like, where do you go? Public health does have some clinics, but they're primarily focused on children. So if you're beyond that, okay, pharmacies are doing it, so you can go there and get it. Certainly in this province, I think right across Canada, pharmacists have taken up that role of being vaccine providers, so you can get it there. And most provinces, like my province, they, Medicare has formed an agreement with the pharmacist. You give it, and as a citizen, I don't pay for it. That's between the pharmacist and the government. So that's one aspect. But the promotion of it, we need more promotion, and with respect to that, and we have to get over this whole hump of our vaccine rates dropping, and there's a number of reasons for that, as I discussed. The other part of the question was, of course, nonsense from the U.S. does not help. Really, if you turn on your television, you watch the news, and they're going to show clips from the U.S., and you've got the head of the Human Health Services, whatever it's called, last name of Kennedy, talking about causes autism. I mean, he was one of the biggest anti-vaxxers globally, to try and represent people to sue pharmaceutical companies about impacts of vaccines on his clients. I mean, he's a guy that told Trump that Tylenol was a cause of autism. So I mean, it's hard. It's hard to get your message across. We are Canada. That's right. We are sort of cutting ties with the U.S. That's right. But the news filters into our news, and it's hard. It's hard not to see. you might say, oh God, they're talking nonsense again. But on the other hand, it might put a little seed of doubt in your mind and say, well, maybe I should try and look that up, or I should ask somebody, or I don't have anybody to ask with. I don't have a family doctor. Gee, is
Right.
that true? And if you have any doubt anyway, it's just going to magnify that doubt.
Right.
So you know, um, it doesn't help. I've talked to some people and they've just shook their heads and say, "What? It's just nonsense." But for other people, it could just be that seeded out. And if you already have that doubt, it just reinforces it. So
Yeah.
it's not helpful.
Yeah.
All right.
Wayne, I
So
got a question
we
for
have,
you.
okay.
Okay.
Is it possible that I mean, we hear on a more frequent basis right now from the United States or from wherever else that, the viruses that we see in the world seem to be mutating more quickly than we've heard before. Now, I don't know if it's because there's more media coverage on this or if it's actually happening. And the fact that you just mentioned that the one in Australia mutated half a dozen times over a course of a season, is this something that we should expect to see more of in the future?
Well, I don't know the exact reason for the mutations. I don't know that every virus is mutating. For example, we're going to talk about measles. That was not a mutation that
Hmm.
caused that.
I see.
That was lack of immunization, and we can get into that. I don't know that they're mutating any more quickly. The flu virus is just known for its ability to change, mutate, and it's happened in previous years. Now, granted, the 7 mutations is more than they normally see, but it could be a one-off. So I don't know that I would say that everything is going to start mutating and changing out there. Now we have climate change. Now, does that affect things when it comes to viruses? I don't know that anybody has said scientifically or evidence-based that it has.
Right.
So,
Right.
um, the flu virus is just known to change, and it changed.
Okay. We have a couple of more comments here. Deborah says it's always a pleasure to hear from Dr. Wayne, whose great advice helped our house and my office sail through a few pandemics.
Nice.
Oh, thanks. Yeah.
And then we go to Jen, who says promotion is a good point. The only promotion on my radar is my parents reminding me. I can't think of seeing any promotion across any channels I am using. Social media channels, I guess, is probably what she is referring to, because I have noticed a number of ads lately on YouTube anyway from the Public Health Agency of Canada about flu season. And then we have another one, Rhyme Arrest says the fact that there's even debates pro-vax versus anti-vax is wrong in my opinion. It's like debating religion versus science. There's simply no debate to have. And we thank you for your comment as
That's a
well.
nice comment. I like that one.
Yeah. Okay. So I guess overall, Wayne, is how would you sum up this part of it? And while you're doing that, I'm just going to put up a map here as to what the flu looked like. There we go. Up until November the 8th. And we have one province that appears that does not have, yeah, so
Yeah,
Manitoba.
that means no data submitted.
Yeah,
So, and even in New Brunswick, you can see that there's a couple of white spots, which means no activity.
right.
I'm not sure that's entirely accurate. So you take this map, it's a good indication, but it relies on data provided by the provinces. So just if they're not getting the data in time by they put that map up, it's going to show gaps and things, and it gives you a general picture. It may not be the most accurate picture.
Right. But looking at it, that aside, just looking at it right now, this is kind of
Hmm.
typical as to what you might expect to see in an average year at this time of the year.
Well, since COVID, we haven't really had an average flu season.
Okay.
The first year after COVID and all the restrictions came off, the masking and so on, um, flu just didn't appear, basically, right? When we were masking and things, it showed the effect of all those nice measures to prevent COVID. It also prevented the flu. But after that, it came back early with a vengeance. It struck, and it was here for about 2 months, and it faded quickly. And then after that, it's kind of got back to normal. But we're never quite sure now. It hasn't quite hasn't quite fell into its usual pattern. So it's a little early than what we would normally see in a typical year. We would kind of see that map more towards December than November in most cases. And so, yeah, it's a little early, but so, Australia, South America, they were early. The UK is a month early and they're well into their flu season. So this year, it's early. And again, I don't know the exact answer to that. But we have not really settled back into our usual pattern since COVID.
All right. Okay, so going from flu to measles, where we have lost our measles-free designation, and I know you and I talked probably about a month, maybe almost 2 months ago now, about at that point you were concerned that we were headed in that direction, and then all of a sudden, bang, here we are. What
Yeah.
what do you attribute all of a sudden the surge in measles in this country? What do you attribute that to?
So just a little bit of background to be called measles free. That's kind of the common term. It's measles elimination status is what it's called in the kind of the public health world. And we achieved that in 1998, and that was done by we went from one measles vaccine to including a booster. So we were about 90%. When we were really, really good at getting vaccines, we had about a 90% coverage from one booster, from one immunization, which wasn't enough. Measles is so infectious; it's one of the most infectious diseases known to man. That you need a 95% vaccination rate for herd immunity, and most people know what that is. But just to recap, that is immunity. 95% of your community is immunized. So if you do get measles in there, it doesn't have very far to go, and it hits that brick wall of people protected, and then it's gone. You stopped it. But if you go below 95%, it is so infectious that it can find those uninfected people, unprotected people, and just spread. So in the 90s, we went from one vaccination in, I think, early childhood to the second one around age 5, depending on the province. And that brought, if you got 2 immunizations, it brought your protection up to about 98%. So that provided a nice protection. And once we did that for a couple of years, we did not have any ongoing transmission or continuous spread of measles within the country. So that allowed us to be called measles-free or achieve measles elimination status. So in order to do that, you cannot have transmission of a particular strain of measles in your country for more than a year. And so we met that criteria. Now, what happened between, just an example, between 2020 and 2024, Canada averaged about 91 cases of measles a year. So you might say, well, gee, we had measles. The bulk of these cases were imported. In other words, somebody got infected in another country, and remember the incubation period for measles is fairly long. It can be up to 21 days. The average is about 10 days. So from the time you're exposed to the time you get sick, it's 10 days. You don't even know that you're sick yet, and you can actually start transmitting it a couple of days before you actually get symptoms. However, we averaged 91 cases a year between 2020 and 2024. Now, we are currently in a large multi-jurisdictional outbreak that began in October of 2024 in New Brunswick. Somebody flew in from out of country that was infected. attended a group area for a wedding. And then when the wedding was over, people went back to other places in the country. And they happened to go to, in particular, places that were very, very low vaccination rates for whatever reason, either religious belief or just not in tune with what was happening with immunizations or understanding the importance of them or having access to them. And it just spread from there. And it was so infectious. And, I was on the show earlier and said, but it's the kind of thing that it's R factor, which is the reproductive factor. But basically, what it means is if somebody's infected with measles, they have the potential to spread that to 14 to 18 other people to make them sick if they are not protected. That is how infectious it is. If you can just think about that, one person in a community that is not protected or having the immunization, 14 to 18 other people will get sick from one person. It's so infectious that if you go into a room up to 2 hours after an infected person left, of course, depending on ventilation, you can still get it, either by touching
Wow.
surfaces or in the air. So it is that's how infectious it is. And so once you get it and it starts spreading, it's a nightmare for public health to try and do contact tracing because there are things you can do once you find a contact to try and stop that person from getting it or to stop them from spreading it somewhere else. But it becomes a nightmare and eventually it just gets out of hand. You don't even know where the contact came from. And that's when it gets into the community. And that's what happened here. This ongoing multi-jurisdictional outbreak of measles, which started in New Brunswick and spread to multiple other provinces, has been going on. And it's the same strain. You characterize the strain in the lab, same strain for not every case because we've had some imported cases from outside, but the vast majority or most of them are the same strain that started a year ago. And because it's gone greater than a year, the Pan American Health Organization, which is the North American office of the World Health Organization, said, sorry, you've lost your measles-free status. So the only way we can get that back is to, we can reestablish our elimination status by once transmission of this measles strain associated with the current outbreak is interrupted or broken and is no longer being spread, through the country or through a jurisdiction. So that's going to take a lot of work. And what the Pan American Health Organization did when they communicated with Canada, that's saying, hey, you lost your measles status, your measles-free status. And they also noted, look, you guys need to improve. Now, these aren't conditions to get back our status, but they said you have to improve your surveillance abilities. You have to improve your data sharing. And what really is meant by that is right now there's only a few provinces where if Eddie, let's say you move from Quebec to another province and the two provinces did not have the ability to see what your medical records were or the status of immunizations. And if somebody said to you, well, have you had your second measles vaccine or some other vaccine? Well, gee, I don't know. My family doc retired. I don't know where the records are. Or I got it out of VON office when they were in business and they've gone out of business. So I don't know. Well, if we had a good cross-country data collecting system, they could just easily go in there and say, okay, yeah, you had measles on such and such a date. So yeah, you're fine, or you need a booster. We don't have that. There's only a few provinces that can actually talk to each other on some sort of limited basis. And that's one of the things that the Pan American Health Organization said, you have to improve this. Like, you need a national database that is interchangeable, that people can find out, or even public health officials can say, okay, in our province, we know that this age group, so much of this age group is immunized to this extent. And it helps you to focus on, well, this is where we need to concentrate our efforts. The other thing they mentioned was that your vaccination coverage has to improve. Our rates are low, and in some areas they're great, they're okay. In other areas they're really, really low, below 50% or lower. Um, and so we have to find ways to improve that. And some of that is outreach, getting out to these areas where that, and a lot of especially in Ontario and Alberta, who had the two highest, the provinces with the two highest numbers of cases. We have over 5,000 cases of measles from this outbreak. Remember, I said we had 91 cases a year between 2020 and 2024. Just since October last year, we've had over 5,000 cases from this one strain of measles through 10 of our jurisdictions. The only people not affected have been the Yukon, Nunavut, and Newfoundland. And Newfoundland is interesting. They've had no cases of measles since 2017. 98% of their 2-year-olds are immunized against measles, and 93% of their 5-year-olds are immunized against measles. So they're doing a very good job, and no wonder they've had no cases. But that goes to show you how effective this vaccine is. It's been around for a long time. It's safe. It's very effective. So, so having said that, the other thing they said was, besides being able to talk, you got to get outreach. You figure out where these communities are, and some of them may just not understand the importance of immunization. And you have to be able to talk to them. You have to get out there and try and get them interested, try and get them vaccinated, so that we don't get these pockets that just are just melting pots to fester it and have it spread elsewhere. So the other thing they said is we have to have better surveillance in Canada. And a lot of this falls on public health. And this has been a bugbear of mine for a long time. Public health, if there's a major outbreak, public health is in the news. And at the end of the outbreak, there's always some sort of, assessment of what went wrong and what went right. And it always ends up with, well, you need more staff, you need more epidemiologists, you need more nurses, you need more whatever the case may be, and you need more money for your budget, you need more money to invest in vaccines. Now, the other thing about this too is, although we get money, each province gets money from Canada for our healthcare system, but you can have provinces that have different vaccine schedules. Some may not have introduced one of the latest, newest vaccines because it wasn't in their budget that year. Or you can have them that COVID, there's one province in particular that comes to mind. I'm not going to say who it is, but a very narrow window gets free COVID vaccine and the rest are paying for it. And so that's because the provinces now are paying for the vaccines themselves. And they're deciding what's maybe cost effective. I don't know. What we really need is a standard immunization schedule across the country. So no matter what province you're in, you know that you will get these vaccines and you'll get them at these ages and these dates, and you'll know that they're free or whatever the case may be. And that just doesn't exist right now. So those are the things that the Pan American Health Organization said, you guys have to improve that. Now that's not a condition for us to get our measles-free status back. That we just have to stop this particular strain from spreading and break the chain and end it, and have it ended for a year, and then we'll get it back. And why is that important? Now, are we on some sort of blacklist? No, we're not. But it just, in terms of healthcare and public health, and kind of the status or where we stand in the world, it knocks us down a few pegs. When we are now lumped in with other countries that you might think would have problems with vaccination, now we're with them. We've lost our measles-free status. So it's kind of like a black eye on our healthcare system, our public health system, and not for public health's lack of trying, it's public health's lack of funding and proper staffing. So, and there's got to be more promotion, there's got to be outreach. People have to know more about immunization, the importance of it, and how to get it out there. With people, so many people without family docs and primary care providers. Yes, we can go to pharmacists, and that's great. That's good that we have that. But short of that, I mean, not every pharmacy does do it, and if they are, they're well booked in advance, depending on the size of the community or whatever. So there's this brings up a lot of
Yeah,
holes in our system.
yeah, it's like a can of worms, really. And when you think about it, here we have a flu season that we're in now, and we have the vaccine that may not be able to, give it the whammy that it needs. And we also have the measles and the increasing numbers of cases, all putting a strain on an already overstretched healthcare system across the country. And it just makes I'm sitting here thinking that you may have your principles based on whatever, but for God's sakes, don't take everything from TikTok or Instagram for as the ultimate truth when it comes to vaccinations. Like, give your you have as an individual, we all have to play a part in trying to ease the pressure on our healthcare system. Otherwise, it's falling apart now, but the wheels are about to totally come off. So we have to play a part. And if that means getting jabbed by a needle, for God's sakes, go get jabbed. Like, I went up last month and I have 2 shots in one arm. And I came away, none the worse for the wear, really. Like, I don't get it. I just don't get the thinking sometimes. I'll stop my editorializing.
Yeah, and one point that Wayne brought up, Gary, and you brought it up a few times in a few of our shows, is our healthcare should be nationalized from coast to coast, from border to border. And what Wayne had just mentioned, that we have absolutely no way of sharing very critical information, both on just standard healthcare for patient, nor do they share statistical information to be able to track a wave or a wave of a measles outbreak or whatnot. I think that's extremely key, and the governing body in the Americas, as Wayne had mentioned, are bang on. Yeah, maybe we don't have to meet those requirements in terms of information sharing to actually get our measles-free status, but you know what? That shouldn't be a reason for our leaders to say, oh, okay, great. We managed to get the measles outbreak under control, and just ignore that, because you know what? It can happen again, and very quickly.
Well, and that's the problem with governments as well. Like, you go back a number of years ago to the SARS outbreak, and there was a major federal or report delivered to the federal government at that time as to the weakness in the public health care system. And everybody was applauding, oh yeah, boom, 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 we're going. And guess what? Maybe some recommendations were put into place, but a
Mm.
couple of years later, at budget time or whatever, it kind of went out the window. Now,
Yeah.
I'm not going to put
Well,
Wayne on the spot because he was working in that field, and he went. You were around at the time of SARS, and then following
yeah.
the inquiry into it and everything, and a number of
Mhm.
recommendations came out of that report. And how many of those recommendations do you think are in place now? Well, my guess is
Well,
our slowness to respond to the pandemic initially is because we didn't have the preparations in place based on what was in the report. Would that be a fair assessment?
there were a lot of things. There were several different commissions and reports, and some focused on Ontario because they were the sort of ground zero for SARS and had the most number of cases, most affected. And so a lot of people focused on that. I mean, you had healthcare workers that were severely sick, and some didn't make it because nobody knew SARS was coming. There was no warning. We knew COVID was coming. It was just a matter of when. Nobody knew SARS was coming. Nobody knew anything about SARS. And after it got here, it became obvious that this is not a severe flu or something we know about. It doesn't behave that way, whatever. And eventually it came out, well, China had kind of known about this and then didn't share it. And more information came out once that was realized. And so it took a while to sort of figure out what it was and how to respond to it. So there was a lot of commissions around, a couple of commissions in Ontario, but there was one called the Naylor Report. He looked at public health across Canada, and through that he recommended the formation of the Public Health Agency of Canada, because prior to that we had Health Canada. We had a number of specialists in there that, as a province, as in my position, I could contact about, say, TB. I could contact about this disease or some environmental thing, but there was no one sort of public health organization there. And so the Public Health Agency of Canada was created. He recommended that there be a chief public health officer for Canada, and that position was created. And he recommended that it be at the deputy minister level, so he or she would not have to go through a bureaucrat to deal with a situation. That they would have the power to issue reports or make statements related to public health without having to have it screened or vetted. And that did happen. Now, that was back, I don't know, let's see, probably 3-4 years after. So late 90s when all this happened. And now the chief public health officer for the country is no longer a deputy minister level. They have fallen down I don't know how far down and to who they report to anymore. So you can see what happens when, after the major event where public health is in front and center in it, and then they do these reports and make all these great recommendations, and some of them come through. That's great, but with time, if you haven't been in the news, well, we're kind of low-hanging fruit. We do our job in the background. We're trying to immunize people. We take care of environmental emergencies. We do things in terms of population health, like smoke-free places acts are created and modified, for example. So, but that's it's not sexy. It doesn't make the news, and you're kind of in the background, and we're low-hanging fruit. So if there's a budget crunch, guess who's going to be sort of caught in it? And I've seen it cycle so much through my career. Oh, here's a big event, have a review. Well, we need to buff up public health, and you do. Then we're not in the news for a while, and suddenly you realize, oops, yeah, we kind of eroded some of our resources here. So it's it's just one of those things that's cyclical, but it's so important. We can see why this measles condition, for example, this situation, if we don't have that surveillance ability, if we don't have some of these basic things that would also help not just public health, but medicine in general, with data sharing across all provinces, then yeah, we just need a whole lot of improvement, but sustained improvement as well. If they're going to go out and do community outreach to reach these communities that maybe don't understand the value of immunization, or for whatever reason have not partaken, that takes staff, takes effort, it takes time. There has to be marketing campaigns. There has to be there's all these social media ways we can do this, besides the standard advertisements, but they have to figure out a way to make the value of immunizations known, and not wait until people are in hospital or ICU or passing away from the disease. So yeah, there's a lot of work to be done, and the measles has kind of exposed that.
All right, and we have a couple more comments to bring up before we let you go. And the first one, Monell's. I read recently the reason the vaccines are down is because this is the first generation that hasn't survived a measles outbreak, so they don't realize how bad it can get?
Well, you know, let's unpack that a little bit. A lot of the problem is we are vaccinating children whose parents have never seen or heard of some of these diseases, whose grandparents now have never heard or seen some of these diseases, because at one point in time, if the parent said, well, what is this stuff? Why do I have to get my child vaccinated? The grandparent was aware of it and experienced it and said, yeah, you need to do this. You know, it's very bad, it's nasty, so you need to do that. We're in generations now that they've never seen, they've never heard. It's kind of a complacency thing. So yeah, there is some truth to that. And you know, whether it's measles or whether it's something else. But if you haven't seen it, that's one of the complacency factors. You know, there's the sort of concern about what do vaccinations cause. Autism, that's been proven many times over through good scientific studies, but it lingers on. I think COVID sort of stirred that up again. But yeah, you know, people haven't seen some of these diseases, but some haven't even heard of them, you know, and but if we don't do it, well, we can see what happens.
Okay, and the final one relates to your comments about the some kind of central data repository for information. And Deborah says, years ago, our countrywide police could not speak to each other. Once we had a system, it made it much easier to solve crimes. And yes, a lot of agencies and municipalities and provinces are now getting into that new digital system where they can switch over and talk to one another instead of calling into their dispatch calls over by I remember covering stories where that would actually happen. And yeah, not a great situation. Why we don't have something where the provinces are talking to one another is beyond my wildest imagination in 2025. But that's a topic for another discussion, and we'll have you back to wade into that with us, Wayne. I want to thank you
Okay.
for taking the time out this evening to come on and bring us an update on this whole situation regarding the flu and the vaccine and what we've been hearing. I think probably you answered a lot of questions and put some minds at ease as to what we can expect and what's going on. And with the measles, once again, yes, we did that show last year on measles. But man, oh man, when you look at how much it's ramped up in the last 6 to 8 months in particular, it's scary. So I want
Yeah.
to thank you for doing that.
Thank
Yeah,
you, Wayne.
just one last thing is that
Yep.
if you haven't got your flu shot yet, yes, there's still time to get it. Lots of time to get it. It's don't give up on it. It's there for a reason, and it still provides protection.
Absolutely. All right, Wayne, thanks very much. We'll let you go.
Okay,
Have a great
thanks,
evening.
Gary. See you,
Cheers.
Eddie. Yep.
Bye-bye.
Bye-bye.
All right, coming up, we dig through the federal budget fallout. But before that, I want to give you a heads up on Black Friday, Cyber Monday special, my friends at Ecamm Live. That's the software I use to produce and stream Night Talk Canada, and as well working with clients. Well, now starting on Saturday and work through to December 2nd, they're offering 40% off on their annual plans for new customers. That's 40% off the annual price for new customers. That's a really, really good buy. And Ecamm Live is software for Mac only, but within that, you can do anything and everything you need to do. And actually, I watched a broadcast the other day. There are a bunch of new features that are coming out in beta very shortly, which have a lot of the influencers on YouTube quite excited. And it's just the next step, but they're always on top of these sorts of things. I've had a couple of questions from time to time, fired it off to support. first thing I've got a response back from one of the two brothers who own the company, who are the original developers of eCam. So I can't say enough about the service, and I just want you to know that you can check it out. There's a 14-day free trial with no credit card required. Just go down to in the description and click the link, and that will take you through to the offer for the 14-day free trial. And I just want to again emphasize that this is just a recommendation from me. It's not a paid sponsorship.
The table will now compile the results of the vote.
Yeas pour 170, 170. Nays contre 168, 163.
I declare the motion carried.
Thank you, sir.
And in Ottawa, high political drama played out on Monday evening as MPs gathered in the House of Commons to vote on the Carney government's first budget. As you saw, the budget was passed by a narrow 2-vote margin. The vote came after a lot of huffing and puffing by opposition parties after the document was tabled November 4. Let's dig into the political theater we witnessed on Monday.
Well, Eddie, following the vote, some of the opposition parties had a lot to say. Green MP Elizabeth May suddenly changed her position on the budget and came out supporting it.
All I heard was the Prime Minister say he'd respect the targets. I didn't hear him say anything more, that he would work faster, change anything that was already in the budget. So why is that enough for you?
I heard him commit to the targets. That is what I needed to hear. And I hear a commitment to work towards achieving them, which will not be easy. We will have to work. We will have to continue to see if we can get this Parliament to work together. It's a minority Parliament. I'm not giving them any kind of blank check, but one has to reach out at a time when we're in a fragile situation vis-a-vis Canada versus Trump. One has to hope that Canadians can trust each other enough to say that was a commitment. I heard a commitment. And if they want to parse it and say you didn't hear what you heard, they'll pay for that, because I'm trusting but not gullible. I want to see we will work together across party lines, because I'm not the only person who cares about climate in that House. The Bloc Québécois members care a lot about climate. The NDP members care a lot about climate, and so do a lot of Liberals, and so do a lot of Conservatives who don't say so out loud because they don't want to contradict their leader.
Meantime, the NDP had some explaining to do as well.
But through these discussions, it became equally clear that Canadians do not want an election right now. The consequences of defeating this budget would not be to improve it or to help Canadians. It would be to plunge the country into an election only months after the last one, and while we still face an existential threat from the Trump administration. On that basis, we engaged in conversations with the government about improvements that could strengthen the budget and earn our support. At this time, the Liberals have not been willing to make those changes. And so, we have decided to put the interests of our country first, to vote against the budget, but to help prevent an election. Canada is facing instability and overlapping crises. In these challenging times, we must put our country's well-being first above partisan interests. When the next election comes, whenever that may be, Canadians will hold Mark Carney responsible and to account for his record and for the choices that he made in this budget. But today, New Democrats are choosing stability over political games.
But Bloc Québécois leader Yves-François Blanchet made no apologies for staying the course in his party's opposition to the budget.
They refused the possibility of having a support from us with very clear conditions which would have been less expensive than what they give on a yearly basis to oil and gas industry. They refused that, and then they refused the possibility to go through the whole process with a partner up to the end of it. So they will live the same anxiety that we have seen this morning with the Prime Minister and Mrs. Joly and Mr. Champagne and who else. Because at each step of this long process, including the committee, they will have to start all over again because they were not good partners for anybody. They exploited the momentary weaknesses of everybody, and this is not how policy should be done. So I believe it will come bite their ass.
And yesterday, Prime Minister Mark Carney was not exactly taking a victory lap.
Very pleased that we passed the budget vote. There are more votes, of course, to come through the budget process, but an important step for our country, protecting our communities, protecting our borders, protecting our way of life, building our country, building locally, building new trade infrastructure, building as an energy superpower, goes to your question. And Canada is blessed. We're blessed with immense natural resources, everything from hydroelectricity through to conventional oil and gas. We're part of an energy transition. We're going to help to lead it. That means Alberta, that means Quebec, that means Ontario, that means all of Canada, it means all forms of energy. And then last and most importantly, this is about empowering Canadians. It's about helping all Canadians get ahead. As I say, protecting our way of life, protecting our transfers to Canadian, getting affordability back established through a tax cut, as well as our essential social programs, everything from the National Food Program through to health care, child care, pharmacare, dental care. All of that is in the budget. I salute the 170 members of the House who supported it. I'm glad it came through, and we're going to continue to work on implementing it.
Well, Monday night was quite the evening as far as must-see TV for political junkies, watching the maneuvering prior to the vote actually being taken, and then watching the vote, who stood, who didn't, who was there, who was absent. All of that came into play because the numbers were so close. And still you knew that the NDP were not happy with the budget. You knew that the Conservatives definitely were opposed to the budget, straight through, no stops. So how is it going to come out? Would one side or the other be able to pull a couple of people in or convince a couple of people to abstain? And as it turned out, there were a couple of twists along the way, including the Conservative MP from Edmonton who resigned last week, sort of. He put a letter in saying he's going to resign, but there's no firm date yet, sometime in the spring, according to the chatter on the Hill now. But he has not taken part in 3 votes related to the budget, including this one, which could have brought the government down had the opposition managed to pull together the numbers to overwhelm the government's numbers. And we would have been into an election around Christmas time. And who wanted that? And that was the whole thing. And the NDP really don't need an election right now because they're in the middle of a leadership race and they're probably still paying bills from April's election. The Conservatives, well, if Poilievre has any smarts about him, he certainly doesn't want an election right now because the party may do okay, but he'll be out on his keister again like he was in April. Yeah. When you look at his polling numbers, his popularity numbers, they're dropping again. So they huffed and they puffed. The Bloc came out and said from the get-go, we have 6 items that we want addressed, and then we will vote in favor of the budget. You address the 6 items, we vote in favor. You don't, we will not vote in favor. And true to their word, they didn't get what they were looking for because Carney and the Liberals were really not negotiating or open to negotiating that hard. And there's all kinds of theories as to why. But the bloc voted as a bloc against the budget. So they stayed true to their word. The NDP, I give Don Davies full marks. He did a really good job in selling why the NDP did what they did. They had 2 members abstain, and you had, so it was just nobody wanted the election. Let's put it that way. And even though they still huffed and puffed right up until the vote was taken, they were also trying to be very, very careful as to making sure that the right vote was recorded and not, a mistake was not made that could have thrown it against the government and brought the government down, and boom, here we are in an election campaign.
Yeah.
In Carney yesterday, like I say, he wasn't exactly taking a victory lap. Sure, I'm sure he's happy that it's over with, but he also, laid it out like there's a lot of study in committees and everything and votes within committees on this budget or aspects of the budget that they're going to have to muddle through and make sure they have the right numbers to come up with the approval. So that's why he was more subdued in his response, I found, or I thought anyway, as to how it went. Overall, though, for the hour or so leading up to it, and in the actual vote in the House, as I say, for political junkies, it was must-see TV. I quite enjoyed it. So.
Yeah, I'm sure you did. Well, you know what, Gary, you mentioned Prime Minister Carney was somewhat subdued in terms of the way he spoke about the outcome of the budget sessions.
Mhm.
Quite honestly, I know he didn't do a victory lap, but if the budget went with resounding success, if you want to put it, with a significant majority voting for it, I really don't think that his pitch or his presentation about the budget will be that much more than what we saw. Maybe a little. I don't think it's his style to gloat. I think it's more his style to actually present facts as it is, basically say what needs to be said and move on. I don't think he would have been taking a victory lap had it been a resounding win. Maybe a little more enthusiasm in his voice, but I think what he said generally represents the outcome of his budget, whether it got pushed through with a couple of votes or whether it got pushed through with 24 votes. I think his presentation would be pretty much the same. And you know what, him essentially outlining what are the next steps in terms of getting this budget pushed through, it just demonstrates to me that, yes, this is the budget that got presented, but yeah, there's a lot of committees that are still working in the background to make sure that what was actually presented actually stays within the confines of what they actually promoted in terms of their budget forecast. So, you know what? I think the way he presented himself was, again, Gary, something you and I use as a word very often, very, very prime ministerial. And I wouldn't have expected any chest beating, even if he won by a resounding number of votes. In terms of the NDP leader and Elizabeth May, you're absolutely right. The way they communicated to Canadians about the outcome from the budget, Elizabeth May changing her decision when last week she said she was going to vote against it, and the leader of the NDP in saying that he was more concerned, and same thing for Elizabeth May, really understanding the fragile situation that Canada is in, and I'm sure they're basically saying that the world is in because of the economic policies and pressures from our neighbors down to the south and Mr. Trump and his gang down there. You can't take that for granted. The man's going to be around for the next 4 years, at least. Let's say that, or at minimum. So yeah, I think that at this particular point in time, heading into the holidays and just coming out of an election earlier in the year, you know what? This is not the time to trigger another election. this is not the time to put a pause on the efforts of the Canadian government. I don't care if it's Conservative, NDP, Liberal, or even Green Party. This is not the time to halt the government in action when there is, at least is a plan to address some of the shortcomings that unfortunately happen to be under the Liberal banner over the 8 years, but shortcomings that are being looked at and addressed moving forward. And obviously, it has to be an aggressive budget. And I'm a firm believer that, you know what, if I didn't see this type of a budget passed by, quote unquote, a hypothetical conservative government, let's say the conservatives are in power, and we didn't have this type of an aggressive budget, I would have been disappointed in them, quite honestly. So I really hope that, we're just looking at political chest thumping here. I think the Conservative Party could have represented themselves better in terms of understanding the fragile situation Canada is in and supported the budget. But I think they chose the political chest thumping route. You know what? This could have very easily turned against them, very easily turned against Pierre Poilievre if an election had been called. And for what gain, Gary? We'd have to basically halt the presses for the next 3 months, 4 months, while we have those people down south doing all kinds of things and running roughshod.
Yep.
I would think that Canada would be left in a very, 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 very fragile and vulnerable position without firm leadership up here in the country that Trump will take full advantage of. Don't, them. This is what bullies do. They look for weakness and they start attacking. So you know what? I am very pleased with the outcome. 2 votes, 12 votes. I don't care. I'm very pleased that the government did not change hands. And I'm just a little disappointed in the Conservative government. You know what? Swallowing their pride. There is next time. We have a leadership. I believe they're still going up for the leadership review come January or so.
Yes.
That they did not support the Liberals on this, and taken the position of the NDP and Elizabeth May. I'm not going to comment about the Bloc Québécois. They held firm to what they were looking for. The Liberals, I'm not sure whether rightly so or not, stood their ground and basically said, no, we're not going to be discussing this now. You know what? There might be opportunities for discussion 6 months down the line, 10 months down the line. But this is what it is right now to drive the country forward and get us away from this American stronghold and stranglehold that they propose keeping on us short term and long term. So you know what? This is what the Canadian government and Canadian governing is all about. The ruling party, being the Liberal Party, is being held to task by the opposition. I said this a long time ago. This is what I was hoping would happen. I said you had also confirmed that you like to have a strong opposition. I think we saw some of that over the last couple of weeks with the jockeying back and forth. At the end of the day, the budget passed. And I think, in my opinion, at the end of the day, the loser out of all of this is unfortunately the Conservative Party in terms of views of swing voters like myself and millions of swing voters in Canada. I think the Conservative Party lost a few people on this, in my opinion. And we'll see what holds in 2026 when we see what the fate of Mr. Poilievre is going to be.
Yeah, that's going to be an interesting scenario. I'll get it out sooner or later. But I was watching Poilievre in question period before the budget vote yesterday, and again he's back to everything he was before the election. It's
Yep.
He's got a couple of key phrases now about the national credit card. It's just okay. It resonated the first time you used it, but let it go after that. Move on. If you can't come up with something original every day or every couple of days, then maybe you are in the wrong business overall. But anyhow.
Yeah. Well, I watched it as well, and some of the comments that he made was, I think at one point he had said he wanted the prime minister to admit that he was wrong and something about the last 8 years of the Liberal mandate. Again, he's going back. You know what? For me, it's a very simple calculation. Yeah, the Liberal Party was, in my mind, horrible, the last two mandates. This is the new Liberal Party. Why can't he get that through his head? You know what? They should have changed the name Liberal Party to something else so he couldn't refer back to the Liberal Party. This is a whole new ball game here. Like, seriously speaking,
Yeah.
every time I turn on the television, let me take a look at what's going on in question period. I can guarantee you, I put money on it. 9 out of 10 times, he'll bring up the last Liberal administration.
Oh,
That's
yeah.
just enough's enough already. Come on.
He's still fighting Justin Trudeau. That's
Yeah,
who he's fighting.
yeah, exactly,
So,
exactly.
okay, we've got a couple of quick comments and then we'll move along. Monel says, I'm so glad that at least we're not going into another election. That's all we needed. Hear, hear. And Deborah weighs in with, at this point in history with trade wars and war threats, any Canadian politician who postures and goes against our government is, in my mind, a traitor. Wow. She's
Heavy
pulling
words.
no punches. Yeah. Get the guns out for sure. All right. Okay, Eddie, I guess everything that can be said about what took place on Monday night and, Tuesday, I think we have said, and so have dozens of others as well. So we'll put the budget to bed for now, and we'll continue to watch the fall of Pierre Poilievre. Did I say that?
Yeah.
Yes, I
Stay
did.
tuned.
Yes, I
Gesundheit.
did. And I make no apologies for it. Coming up, we have Eddie Sports Pulse with a look back at Grey Cup 2025. But first, I just want to let you in, if you're ready to launch a new web page or looking for a new provider, Web Hosting Canada, WHC, is in the midst of its Black Friday promotion with some great deals for new customers, like web hosting plans starting at $249 per month on a 12-month term. You will also find special pricing on domains and other things like premium SSL certificates and business email. Don't wait too long, though. These specials last through December 2nd. Now, WHC, in case you don't know, is a Montreal-based company, and I've been a customer for almost 5 years. You can get more information simply by clicking the affiliate link below. Again, this is a recommendation. It's not a paid sponsorship. Now, we're about to get into what everybody has been waiting for from a football perspective. It's time to make that leap from politics to football, and that means Eddie Sports Pulse is back with a look and a wrap-up on Grey Cup 2025. Eddie?
Thank you, Sir Gary. Ladies and gentlemen, Gary, last Sunday at the Princess Auto Stadium in Winnipeg, a staple of Canadian tradition spanning 116 years, a week of Canadians from coast to coast gathering in the host's Grey Cup city of Winnipeg, partying all week, flapjack breakfast, getting ready for big game. The Saskatchewan Roughriders and the Montreal Alouettes, the 112th Grey Cup, and Gary, it did not disappoint. Coast-to-coast broadcast play was, of course, by TSN, who is the official broadcaster for the CFL this year, and was also shown on CTV. And was all the pregame hoopla. There was a pregame show, a band on the field, the play-by-play setup by TSN. Trying to make a show in the field. Kind of started to look like TSN was trying to kind of get a show where a football game broke out, and it didn't kind of work out the way I expected it to. But you know what? It is what it is, and everybody was kind of waiting for the formalities to go by and get the game going. And Gary, you know what? It's too bad that there was a halftime show with MGK. I just don't get that type of music. I don't get that type of band, although I'm sure he's quite popular. And
Your
the fact
age
that
is
he is
showing.
yeah, and you know what? It's not so much that, and the fact that the commissioner and the CFL brought in American talent when we have some of the best bands and the best musicians in the industry available and more than willing to participate in a Grey Cup show, and they bring in an American. Well, you know what? Maybe I'm just playing favors here, but I tried to keep an open mind and just not time to go for a lunch break and then come back before the second half started. But anyway, Gary, aside from all of the showings, all of the show and the makeup that the TSN tried to put around this, the game, absolutely wow. First of all, the stadium was a sellout. All tickets and all seats were sold out, and we had the Saskatchewan Roughriders, who I mentioned last week, were 12-6 for the regular season, versus the Montreal Alouettes from the Eastern Conference, who were at 10-8. And you know what? There were quite a few stories of the game that kind of go hand in hand with what happened during the game. Last week, I mentioned for the Montreal Alouettes in young quarterback Alexander Davis, who's only in his second year, and from tail end of last year to this year's Grey Cup, has not lost a single game yet. He has won 13 straight games that he started in. And the entire story of the game, the entire story for the Montreal Alouettes was around Davis Alexander, because the week before in the East Division final against the Hamilton Tiger Cats, he hurt his leg. He pulled a hamstring, and apparently pretty badly. And, of course, the media was following him around. They're watching him during practice, how he was running, and so on and so forth. And even the TSN cameramen were just following him around the field before the Grey Cup when they were doing their warm-ups, focusing on his hamstring and talking about his hamstring, right? You know what? So that happened to be a story for the game, because his successes during the regular season and his 13 wins, of course, is his very strong and accurate throwing arm, but also his swiftness and ability to run with the ball and change on a dime, which kept defenses wondering what the next move was going to be. So that was the story of the game for the Montreal Alouettes. For Saskatchewan Roughriders, it's veteran quarterback Trevor Harris, and running back Ouellette, who's basically a monster, an absolute tank of a running back. And I just wanted to correct something I said last week, Gary, that was erroneous. I had mentioned that Trevor Harris had previously won a Stanley Cup with the Montreal Alouettes. That was a mistake. It was Cody Fajardo who gets the credit for the 2023 win. Trevor Harris was with the Alouettes in 2022, but he had left the team in early spring in 2023. So veteran quarterback Trevor Harris was actually looking for his first championship. And all of this, Gary, at the right young age of 39 years old. The man is 39 years of age, trying to win his first championship. And you know what, Gary? It was a close game. It went down to the wire. As a matter of fact, the last play of the game was a Hail Mary pass into the end zone for the tie, pretty much. And after 4 great quarters of football, the Rough Riders won their 5th Grey Cup, winning 25-17. All credit to the Saskatchewan Rough Riders, who basically led the league from start right down to the Grey Cup championship. But boy, they could have lost it quite easily with a very resounding Montreal Alouette performance. The first quarter was actually pretty close. And, there was a couple of plays during the first quarter that I believe they're both in the first quarter that kind of set the stage and tone for the game, because you know how it is. It's all about momentum shifts and swings and taking control, right? On the opening drive of the Saskatchewan Roughriders, Trevor Harris threw a ball right into the hands of a Montreal Alouette defender, who all he had to do was catch the ball and walk into the end zone for a touchdown. I think what happened with this young man is, before he caught the ball, he was thinking about his touchdown dance and dropped the ball. I could not believe it. I promised my wife I would not curse. I would not get angry at the television. And of course I did. I could not believe my eyes. He dropped the football and he would have waltzed into the end zone. Well, he must have been thinking about his touchdown dance. But you know what? It's part of football. And then later on in the same quarter, the Saskatchewan Roughriders were driving for a touchdown. It was 3rd down and some odd. And the ball was thrown to a Rough Rider receiver, and a Montreal Alouette made a great diving stop to knock the ball down. And we all thought the Riders were going to kick a field goal, and that's it. It's not a touchdown, it's a field goal. And to the chagrin of Montreal Alouettes, the coaching staff of the Riders asked for a review on the review and asked for an interference call, and they got it.
Yeah,
Gave him a second
I
chance, and they
remember
put it in
that.
the
Yeah.
yeah, they got that ball back and they took it into the end zone as a good team's supposed to. So you know what? That's the way the game goes. It was a pretty close call. I can't say whether or not it was the right call or not, but that's how football goes. So the Rough Riders took control of the game in the second quarter, where the Alouettes did not score, and the first part of the third quarter. And you know what? I was really saying to myself, "Oh my God, is this going to be a very rare blowout?" Because Grey Cups are always down to the wire. Unlike the NFL, these things go right down to the wire. So the Riders took control second quarter and third quarter. So it was 25-7 right at the beginning of the, let's see, the first 10 minutes of the third quarter. It was 25-7 Riders over the Alouettes. Quarter four, the Alouettes come roaring back, Gary. And that's what makes football great, especially in the CFL and three-down football. Anything can happen. At 7:52 of the fourth quarter, we were within tying the game. Okay, that's we're one touchdown with a touchdown and 2-point convert to tie the game. Okay, so the Alouettes are roaring back. Now with about a minute and change left on the clock, if I'm not mistaken, the Alouettes are on the Rider 2-yard line. They need 1 yard to get another set of downs to get a first down, 2 yards for a touchdown. The short yardage team came on. The short yardage quarterback came on, who was really, really reliable, took the ball, ran into one of his players, fumbled. Alouettes lost the opportunity to tie the game. So we're all saying to ourselves, oh man, that's it. Game over, game over. But this is exciting football. The Montreal Alouettes stacked up the Saskatchewan Rough Rider offense. We actually got the ball back with seconds remaining on the game clock. And Alexander Davis was moving the ball, and he was actually starting to run. Listen, might as well run and be in agony, but he did this. He's played a great game so far. At one point, he was running out towards the end zone, and he just got a slight push where he took a funny step. And Gary, I don't know if you watched that part of the game. He screamed as he came out of the sideline. Excuse me, I meant sideline. He got pushed off on the sideline. You can hear him screaming in pain. As he stopped to turn back into the play to get back into the game, he's still screaming, limping on his leg. He did not come off the field. And he took that last snap. He took that last throw that ended up in the end zone. And unfortunately, the Alouettes didn't come up with it. And a well-deserved win by the Saskatchewan Roughriders, 25-17. Another excellent, great display of competition, display of ups and downs in the Canadian style of football. Exciting, always exciting, Gary. And I was not left disappointed. And even speaking to fans that left the stadium, and you had green shirts representing Saskatchewan Roughriders, you had blue shirts, the Winnipeg local, and a lot of the Winnipeg Blue Bomber fans were cheering for the Montreal Alouettes, and there was a huge contingent from Quebec that was actually there as well. So you know what? If there is something that does unite Canadians, politics aside, all that crap aside, is Canadians bind together when there's a good fight to be fought, and they'll also bind together in recognizing traditions. And the CFL is a tradition that's lasted for more than 100 years, Gary. So you know what? I haven't had the privilege of attending a CFL game. It's one of my bucket list things to do. And you know what, buddy? Maybe you can write it down as a bucket list item for yourself too. And we'll just either take the wives with us, or you and I go by ourselves to do a CFL game as part of a bucket list, because that's something I just love to do.
Mm-hmm.
And that was it, Gary. I mean, I think you watched the game and you were pretty much entertained yourself in terms of the quality of football.
I was, and having just 3 downs instead of 4 downs really does kind of keep the game moving along.
Yeah.
and there didn't seem to be like a lot of long stoppages between plays, which was great. Um, and coming back around to the new commissioner and some of the changes he's making, including the glitzier halftime show and the pregame show, like which I could have done without. But anyway, it could be that he's trying to appeal more to the U.S. market for TV, because that game was carried by CBS Sports Network.
That's right. Yeah.
Yeah, so that may be part of what's driving it, but I understand it's revenue, but geez, you don't alter something and kind of sell out what you have, a good thing going for the sake of a few extra bucks and water down the product, or upset the fans with the way it's going. So, and again, Eddie, I think that probably now that the season has wrapped up, sometime through the winter, coming into the spring, maybe we should have a look at some of these changes that he has put out, because as I've mentioned before, and
Yeah.
there's a lot of opposition. I was surprised the first time you mentioned it, and I'm just kind of scrolling through Facebook and a couple of other things after that, and all of a sudden I've realized, like, there it is, it's popping out. Like, people are not happy.
No, and you know what? I mean, these are football fans,
Yeah.
paying season ticket holders, and the season ticket holder is not your 20-year-old. First of all, okay.
Yep.
Typically, they're in their late 30s, 40s, 50s, 60s, and 70s. Some of like myself, I used to be one, right? I mean, I was considering going again, but not with these rule changes. I mean, the rule changes, Gary, at the end of the day, and again, it's another show. It's really Americanizing the style of the game, except for three downs. What's next? They're going to get rid of the three downs.
That could
And
very well be.
and in my opinion, I mean, the commissioner used to work at TSN. And you know what? I know Torontonians are not very favorable, are not favored to the Toronto Argonauts. They haven't been kind to them, even though they field some great teams. And it's all about NFL, 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 NFL. Well, you know what? If Toronto does not like the CFL, why does the rest of the country have to change the style of football to accommodate Toronto? And TSN, of course, is based out of Toronto, right?
Toronto, because
Well,
it is the center of the universe in Canada.
yes. Especially if you ask Maple Leaf Country, it's the center of the universe. So
Exactly.
I've heard of that one before. But anyway, Gary, I don't know if I think these rules are being pushed through and shoved through as opposed to voted through. There have been zero surveys done to the fan base and asking them what they think. The people who have kept the CFL running for over 100 years, Gary, nobody bothered to ask anyone.
Wow.
Which is, I think, a travesty. And the second thing is, in order for these rule changes to go through, the board of governors, and there's a representation from every team, has to vote or has to have voted to proceed with this. And then it causes problems for amateur football, and it causes problems where stadiums are being shared. Right, the Alouettes shared their stadium with McGill University. What are they going to do? Move the goalposts every game? I don't get it.
I
But
never thought
anyway,
of
that's a
that.
whole other
Yeah.
show in the springtime, Gary.
Yeah,
I'm sorry I went
exactly.
off on a tangent. I'm passionate about this.
Yeah. Okay, and that's going to wrap things up for tonight's edition of Night Talk Canada.
And a big thank you to Dr. Wayne McDonald for helping us make sense of shifting flu strains and Canada's measles setback. And Ottawa remains on a knife's edge, and we'll be watching the fallout closely. I'm Eddie Tkalik. Good night.
Remember to like, subscribe, and share if you're watching on YouTube, and like, follow, and share on Facebook, and always drop us a comment. We are also on YouTube Shorts, Facebook Reels, Instagram, and TikTok. Night Talk Canada returns in 7 days. I'm Gary MacDonald. Good night.
Good night.